Hello, I'm Patricia Stark. Welcome to the GC America Lunch and Learn series. Today, we're going to learn about two revolutionary products from GC America, MI Paste and MI Paste Plus with fluoride. This is really exciting because in just a few moments, you'll be introduced to one of the most natural, easy to use, and effective family of products on the market today. So let's join our Lunch and Learn team now as our presenter introduces them to MI Paste and MI Paste Plus with fluoride. So sit back, relax, and enjoy your lunch.
Thank you for joining me today. I'm here to discuss an innovative new product called MI Paste. And MI Paste is a tooth cream that delivers bioavailable calcium and phosphate to the teeth. It actually can resist an acid attack and bring your pH level back to a healthy pH. This product, MI, stands for minimal intervention, and it's a wonderful product that you can use in your office and for home use. It is not a toothpaste, so you don't brush with it. What does MI stand for? Has anyone ever seen this sign, recaldent? Do you know what it is? No? Okay. Recaldent is basically our patent formula, and it's two parts. The first part is ACP, which is amorphous calcium phosphate. And if you do any research, calcium and phosphate is not stable in your mouth alone, so it lasts maybe 7 to 10 minutes depending on the pH of your saliva. What we've done is we've added a carrier, and the carrier is a sticky milk protein. It's casein phosphopeptide. That sticky milk protein sticks on top of your enamel, your gums, and your plaque, and actually stabilizes the calcium and phosphate to soak into your enamel rods and your dental tubules, and it hangs around long enough to actually remineralize your teeth. And that's how MI Paste works. So who's this product good for? Do you guys know who's this product good for? Yes?
People with sensitive teeth?
Wonderful, yes. It's a remarkable product for sensitivity, so post-bleaching, or anyone that's suffering from xerostomia. This product is so effective that it actually can reverse white spots. So it's wonderful for if any patient is in orthodontics, and you can brush with it on if you are in active ortho. Other than that, most people take a pea size of MI Paste and smear it on their teeth after they brush and floss. That's 80% of users use it that way. Some people require a tray form, so if you already are a bleacher, you can use your trays, or if you are trying to reverse a white spot. And if you are in active ortho, you can brush it on.
How about cavities?
It's a wonderful product for cavities. So this product can actually resist decay, and it strengthens your enamel to resist decay. So for instance, if you have young children, a lot of children aren't the greatest brushers. They may have heavy plaque. The beauty of this product is that sticky milk protein sticks onto plaque. So it works in a dirty mouth as well. So it can resist decay, and it can stop sensitivity, strengthens your enamel, and generally brightens your smile. It's literally like a nourishing lotion for your teeth. And MI Paste comes in MI Paste without fluoride or MI Paste Plus, which does have fluoride in it. And it's 900 parts per million of sodium fluoride. So you can choose which one you'd use. Generally speaking, we recommend for children under 6, or people that are allergic or don't like fluoride, or pregnant women, not to use the MI Plus. They can use the regular. But there's one thing that you need to know is when you brush with a regular fluoridated toothpaste and then smear on MI, it facilitates that fluoride to its maximum use and works synergistically. Because if you are suffering from an acid imbalance, that's where you need this product. So if you have xerostomia, if you are on certain medications that cause xerostomia, elderly, if you are high plaque, ortho, sensitive patients, patients that are high risk to decay, those types of patients may be having an acid imbalance, and we need to give back the calcium and phosphate to their saliva to create remineralization.
What's the different flavors this product comes in?
That's a great question. MI Paste Regular comes in 5 different flavors assorted: Tutti Frutti, melon, mint, strawberry, and vanilla. We also have MI Plus, which comes in those assorted flavors, or you can get 1 case of mint, and eventually you will be able to get 1 case of vanilla. So that's how it comes in. You generally get 70 applications per tube, and 4 to 6 weeks. If you're putting it in a tray, it won't last as long for obvious reasons. But we recommend that you use it 2-3 times a day, depending on what you need it for. If you're going to use it just once, nighttime's the right time. Yes?
I've heard about this product, Recaldent. Are you the only ones that have a product currently that has Recaldent in it?
Us and Cadbury. So Trident gum has Recaldent in it, and it's 0.06%. We have 10% Recaldent in our product. So it's a much higher dose. So GC America and Cadbury have Recaldent in the products.
Well, we've certainly covered a lot in our introduction. Let's review a couple of key points. The MI Paste line of products, all with the active ingredient Recaldent CPP ACP, are like a tooth cream that supplies essential bioavailable calcium, phosphate, and fluoride to your teeth. Recaldent has been shown to assist in the remineralization of the tooth structure. Now, we all know that these are minerals that teeth need. It's a serious problem because the bioavailability of calcium and phosphate can be impacted by certain conditions in the mouth. There was no simple solution until now. The MI Paste line makes these minerals readily available to your teeth because of the proprietary formula called Recaldent. Recaldent is a combination of 2 parts. The first part is amorphous calcium phosphate, or ACP. This is calcium and phosphate in their simplest form. In fact, since the 1980s, there have been over 140 clinical and scientific studies performed on Recaldent CPP-ACP technology. And every time, Recaldent has been proven to bind readily to pellicle, plaque, soft tissue, and even hydroxyapatite when applied within the mouth. The second part is the vehicle for delivery, casein phosphopeptide. This is a sticky milk protein that allows the calcium phosphate to literally stick to the enamel surface and to be safely absorbed over time by the enamel rods and dental tubules. This is what makes the MI Paste and MI Paste Plus different from all the others. Substantivity is key. The result aids in the remineralization of the teeth. And for patients who are in need of fluoride, there is MI Paste Plus, containing 900 parts per million of fluoride from sodium fluoride. So who can benefit from using the MI Paste line with Recaldent? Your patients who have sensitive teeth, who have an acid imbalance, those with white spot lesions due to orthodontic treatment, who are at high risk for decay, and for those who whiten their teeth or just want a brighter smile. Let's face it, MI Paste and MI Paste Plus can strengthen your teeth no matter who you are. So whether it's MI Paste or MI Paste Plus, this is something your patient takes home and is easy to use. It's most commonly applied with a finger or cotton swab directly to the teeth after brushing and flossing. While neither MI Paste or Plus is not a toothpaste, orthodontic and bleaching patients can apply it on their teeth with their fingers, or they can use a tray for an even tooth coverage. And they both taste great. They're available in 5 flavors that your patient will truly enjoy: Tutti Frutti, melon, mint, strawberry, and vanilla. Now let's get back in there with our Lunch and Learn team to find out more about patient home use and who will get the most benefit from the MI Paste line of products.
So now we're going to discuss who needs this product and how you would use it. Like I mentioned, 80% of people take a pea size, put it on their finger, smear it on after they brush and floss. So twice a day is fine. If you're only going to use it once a day, nighttime is the right time. If you are in active orthodontics, you would brush the product on, and that's only so that you don't poke your finger with the pokey brackets. And if you want, you can use it in a tray form. So let's discuss who would need this product. Do you do bleaching at your office? Any sensitivity? That's usually the number one complaint besides price. And bleaching, it really helps to use this product. So regardless if you're using it if you're having in-office bleaching or if you're doing take-home bleaching, I highly recommend that you use MI Paste after bleaching so you can put it in your trays. If you don't have trays, you can smear it on. So it's regardless of what product you're using, MI Paste is a must-have for the...
When can I expect the sensitivity to go away after application?
It's usually almost instantly. Within 5 minutes, you will have relief. And that's with just one use. If you use it over a period of time, your sensitivity usually does not return. Also, some people may require, if they come to you and they have sensitive teeth and you perhaps think that they're not a good candidate for bleaching, you may want to make them custom-made trays, don't deliver any bleaching system yet, and actually have them use MI Paste in the trays, wear the trays twice a day for 10 minutes to strengthen the enamel to prepare them for the bleaching process. And then I would recommend that they should wait 24 hours until they come see you again to deliver either the bleaching system if it's take home or to do the in-office bleaching.
So just to clarify, so you're saying it is okay to use prior to bleaching?
That's correct. You can use it prior to bleaching. I would recommend 2 weeks. You just don't want to put MI Paste right before bleaching because we are filling the enamel rods and the dental tubules with MI Paste, with calcium and phosphate. The hydrogen peroxide is actually removing it. So we want to wait 24 hours or so, or 2 days, until you leave the rods and the tubes open to accept the hydrogen peroxide. Okay? Now, ortho. Even if you're not an orthodontist and you're not doing orthodontics in your office, we highly, highly recommend to use MI Paste during ortho and after. And in this case, you can brush this product on. So you would just take your toothbrush and brush it on, but it's not a toothpaste. You would still brush your teeth first. Yes?
Can you use the same toothbrush that you apply the MI Paste as the same toothbrush that you would brush your teeth?
Yes, you can. That would be fine. Not only does this product help with decalcification marks, but it actually can help prevent interproximal caries because it is resisting an acid attack. And that's the beauty of this product. This product is so unique when it comes to bringing your pH back to a healthy pH in your saliva and resisting an acid attack by buffering the plaque acids. Children, wonderful for kids. I don't know if you guys have any kids, but this is a great product. A lot of them aren't the greatest brushers, so they have some heavy plaque. And again, the sticky milk protein ingredient sticks onto plaque, so it works in their mouths as well.
Is this a recommended product to give for children during their prophies instead of direct fluoride?
I would recommend that you still use the fluoride, but it's definitely a take-home product that they would purchase from you and they would use it at home after they brush. I would have the parent dispense onto their finger and have the child smear the paste on. The compliance is really high because it tastes great. It tastes like a sweet yogurt. So children like it, everyone likes it because it doesn't have an obnoxious, disgusting flavor like fluoride or aftertaste like fluoride. Root caries. We all see people in our practice with root caries. My question to you is, what is your protocol when you have someone like this? What do you usually recommend for your patients?
We have some patients on Prevident, so would it be okay if they use both products? Is it safe to use both?
That's a great question. And Prevident is great. Prevident has one component to remineralization, and that's fluoride. Our product has calcium, phosphate, and fluoride. You need all three minerals to remineralize the teeth. So what we recommend is if you do feel that this patient needs a high fluoride toothpaste or rinse, we recommend that you use that and then wait a half an hour until you use your MI paste. Generally speaking, I tell my patients to use Prevident in the morning and then throughout the day to smear on MI, and at night brush with a regular fluoridated toothpaste, smear on your MI, and go to bed. That's what I think is the best. Now, acid challenged patients. We all see people that are acid challenged. This is an amazing, remarkable product for anyone that's suffering from acid reflux, if they're suffering from bulimia, or in this case they're showing a pregnant woman. As you all know, the hormones change when you're pregnant and it changes the pH in your saliva and becomes more acidic. That's why this product is so wonderful for those patients, because it will help resist acid attacks and it will resist further wear on the teeth. They show a baby here, so it's even perfectly safe on babies. A lot of times babies tend to, they get their teeth between 4 and 8 months, their first teeth, they're cutting their first teeth, and sometimes they may have suffering from a little bit of, they're still spitting up. This is a wonderful product for that. So you can smear it on their little baby teeth. Modifying lifestyles. For instance, say you have a patient that is a heavy smoker or likes to drink a lot of coffee or likes their wine or alcohol. This is a great product, because generally those patients suffer from a dry mouth, and we are giving them back the minerals that they need to replenish their enamel. So it is a wonderful product for those. Also, if you have someone that has porous enamel, once you or your hygienist has done a great job cleaning their teeth, GC highly recommends that you use MI paste. Because it seals the tubes, you'll have less likely chance of restaining. Elderly, wonderful product for geriatric patients. Why? Because the older you get, you tend to suffer from xerostomia. Again, they have an acid imbalance. We are bringing back the minerals they need, and also we're making them more comfortable. But because this product has a flavor, initially your saliva starts flowing, and that really is comforting for the patient. Also, some of you might put in a beautiful new crown, and you'll find 6 months later they have root cavities. This is a great product for them to just apply at the gum margin, and it can definitely help prevent root caries. So it works on enamel and dentin. And anyone that is immune challenged needs this product. It actually can help protect your gingiva. And there are over 100 case studies on this product, and it's a remarkable product. Do you have any questions?
Yes. Do you need a prescription for this?
No, you don't. But the only person that can market and sell this product is a dentist to their patient. So you can't buy this in the store. You can't buy this at a supermarket or a drugstore. You can only buy it from your dental office.
Hey, so have you been paying attention? Well, I hope so, because I'll probably quiz you at the end of this. So how can your patients get MI Paste or MI Paste Plus? Anyone? That's right. They get it through you. They buy it at your office, and they're going to love it. It's so easy and safe to use, and each of the MI Paste products has FDA clearance. So whether you use a finger or a tray, MI Paste and MI Paste Plus are the perfect adjunct to your patient's favorite toothpaste. Explain to your patients that it could be used 2 to 3 times a day. But if you sense that someone is more likely to use it once a day, tell them nighttime is the right time. So who are the patients you might want to recommend an MI Paste product to? Let's talk about sensitivity cases first. In any case of sensitivity, the MI Paste line of products will help. But let's look at a very common cause of sensitivity, bleaching. MI Paste or MI Paste Plus can be used afterwards regardless of what bleaching product you or your patients are using. After applying the MI Paste, the sensitivity goes away in about 5 minutes, and over time it will dramatically lessen or simply go away altogether. When you get a request for bleaching from a patient already experiencing some sensitivity, have your patient use MI paste in trays for 3 to 5 minutes, 2 times a day, for about 2 weeks before you bleach. Instruct them to stop use of MI paste 1 to 2 days before their appointment. They can resume with MI paste treatment later that same day. But MI paste is great for children, too. It works wonderfully because of its ability to stick so well to the tooth and plaque, and it has a taste that kids will really like. Remember, MI paste is recommended for children age 6 and under. MI paste plus is for children over age 6. Okay, let's look at acid-challenged cases. For patients with acid reflux, bulimia, athletes who drink sports beverages, pregnant women, the elderly, those people under medical treatment taking medications that result in reduced salivary flow. The MI paste line will help prevent formation of interproximal caries and buffer pH levels. It will also stop wear from acid erosion and decrease or eliminate the sensitivity by addressing the cause. For patients with crowns or root caries, the MI paste line works effectively on the enamel and dentin. In fact, it can be used in conjunction with your patients who use products such as Prevident. Do you have any patients who drink, smoke, or on medications that cause dry mouth that reduce their salivary flow? Well, using MI paste or MI paste plus will decrease dry mouth while it remineralizes and replenishes their enamel. It is beneficial for patients after a cleaning. It will seal the tubules and resist staining, so their smile stays wider longer. Okay, I feel like I've been talking enough already, so let's get back in there for the final portion of our Lunch and Learn.
GC offers several ways to market and educate your patients with MI paste and MI plus. We offer this marketing kit, which comes with different backdrops, and it also has patient leaflet on how to and who needs this product. It's not in dental terms, it's in layman's terms so your patient can understand it. They come in different backdrops. So we have a dry mouth. Are your teeth sensitive? And do you wear braces? Do you whiten your teeth, which is a great one if you are cosmetic practice doing a lot of whitening? And do you drink soft drinks? So these are some ideas that you can use, and you can have these marketing kits in your hygiene operatories or in the front reception area if you wish. We also have several different brochures that can help with your staff and your patients to guide you on who would need MI paste and how to use it. This is a product that you can actually profit from because you are educating your patient, and it is basically a direct resale. Your patients will come back and purchase this product from you because it works. Any questions?
Is there a website that our patients can go to if they'd like to get some more information?
Yes, it's mi-paste.com. And that's a very helpful website for your dental personnel.
Can I link my website to your website?
Yes, you can. That's a great question. Yes.
I have patients that are lactose intolerant, and you mentioned that there is casein, a milk protein in this product. Will that affect any of my patients who are lactose intolerant?
You can use this product if you're lactose intolerant. We recommend that if you have a true milk protein allergy or a hydroxybenzoate allergy, not to use MI paste or MI plus.
Is there more fluoride in this product than you would find in an average fluoride-based toothpaste?
No, it's about the same. It's 900 parts per million, so 0.2% sodium fluoride. Any other questions?
How long does the average tube last for our patients?
Usually you get 70 applications per tube, or 4 to 6 weeks. If you are using a tray form, you will go through the product quicker. You can put it directly into the trays, or you can apply the paste first and put the tray over top.
Would you recommend this product for people who are not presently showing any signs or symptoms?
Yes, it's literally like a protective cream for your teeth. I always use the analogy of a nourishing cream that you would use on your face, a protective cream, to help with wrinkles and SPF 15 or 30 or whatever. This product is a nourishing cream for your teeth that's going to deliver the vitamins you need. It's going to protect your enamel. It's going to stop sensitivity. It's going to help prevent cavities, and it's generally going to brighten your smile.
I find that some of my patients may resist. They come to a dental practice and quite often they expect something to be done, to have whether filling or drilling or some light is the perception, and something as innovative as this with just application of a cream, and they don't see the results straight away unless it's a sensitivity that they can feel. How do I overcome that?
This product does work almost immediately. So for instance, I highly recommend that your hygienists and your dental professionals can use it prior to root planing and scaling. Actually bring your patient in, make sure they don't have the milk protein allergy, and apply it. You can apply it directly with a finger or a cotton tip applicator, and then give it about 5 minutes uptake. So you can take the necessary x-rays or update the rest of the medical history. Bring your patient down and start working on them. Even with a Cavitron, 6 patients out of 10 notice a difference the first time. So much so that you may find that you don't even need to anesthetize anymore. It's that effective. And when you see those results, that's when patients will want to say, where can I get this product? Who makes this product? How can I get it? Because it really, really does work. It's unique and it's effective.
I think a big trend in dentistry with a lot of patients, patient education and patient IQs have gone up dramatically in the last few years. And I think a lot of patients are getting used to the concept of minimal intervention. When they think of smile makeovers, they think of concepts that can be done within dentistry that are minimal intervention. And as more patients want less treatment, I think this type of MI Paste product fits right into that regimen. What can I do to maybe be preventative at the same time, a lower cost than maybe what it would cost to maybe get a filling, and also at the same time, what can I do to be a little bit more preventative? I think this product works great for being minimally invasive.
That makes sense. In fact, I went to a seminar at a big convention the other day, and the KOL was talking about how our profession and the medical profession has kind of moved closer together, and this sounds like a medical model, to solving dental problem where you're treating the cause and not the symptoms.
I think for the success of this product, I think it doesn't need to just come from the doctor. I think this is something you got to take this product. You've got to have all your employees. You got to have all your employees try it out. I think this is a great product to spread on everybody's fingers and have them put it on themselves. I think once everybody realizes it tastes good, what the benefits are, you have your whole team approach into this product. Once you have your team on board, I think it's very easy to show patients why you think it works so well.
And it's so easy to use.
Yes,
it's a no-brainer.
And I think, history, we know fluoride works, but fluoride is just one component to remineralization. You need all 3 minerals to remin. You need fluoride, you need calcium and phosphate. In fact, calcium and phosphate play an extremely important role in your saliva to create remineralization, and that's what MI Paste is giving you.
I think when we talk to patients also, I think one of the big things is from all the marketing that goes on throughout the country, they're only aware of fluoride. But yet if we take them back to their childhood and we talk to them about drinking milk and the calcium makes strong teeth, now we talk about a product that we can give to them that has calcium, has phosphate, and can make their teeth stronger. I think a lot of patients can relate to that type of concept.
Absolutely.
It's really amazing how such a natural and simple solution as MI Paste or MI Paste Plus can be so easy, and the timing is right for meeting the needs of today's patients. With people wanting minimal intervention treatment and goals of treating the cause rather than just the symptom, MI Paste products answer the call. It contains the minerals for teeth patients need, and because they're so familiar with the benefits of milk and fluoride for healthy teeth, MI Paste just makes sense to them. MI Paste and MI Paste Plus are really like vitamins for the teeth. You'll notice very high compliance from your patients too. It tastes so good and the results are dramatic. You'll also notice how nice the continuity program that MI Paste and MI Paste Plus create. Whether you suggest MI Paste or MI Paste Plus, your recommendation will benefit your practice because of how much the product will benefit your patients. So how do you let your patients know all this? Well, GC America is here to help. You'll be provided with marketing kits for your waiting room. These contain literature and a video that present information about the benefits of the MI Paste line in a way that your patients will really understand. Attractive signage and practical trinkets will remind your patients to ask for their MI Paste. And GC America even has an educational, patient-friendly website that you can link yours to. Well, that's about all we have time for. I hope that you really enjoyed our Lunch and Learn for MI Paste. If you have any questions, just give us a call or go to our website, gcamerica.com. Thanks for watching, and finish your day off right with MI Paste. Hey, are there any more cookies over there?